We're smooth 98.1 FM. It's gone exactly a minute past the hour of 9 o'clock. It is the 1st of December 2023. It is a Friday. And it is a day where, even as much as we're happy to feel good Friday, it is a new month and counting out of the year 2023 gradually. Let's see, 31 days in December. So one day out, that gives you 30 more days out, and then you're welcome in 2024. But let's get on to this conversation because it is very, very important we have this, because a whole lot, it depends on if you want to make it dirty, a kind of December, then I think you should stay close to the radio and then other things would follow. So for us this morning, the 1st of December every year is celebrated, well, as a means of awareness, advocacy, as the World AIDS Day. So as it is time for us to see the red ribbon around, but we need to begin to pay attention to the details so we don't miss the import of today. So to help us break it down, as he promised on Wednesday that he will be back to speak with us on this day, I've got Dr. Adekunle Abiona, health specialist, speaking with us this morning. Good morning.
Good morning. Good morning. Feels good to be back here.
Yeah.
Happy New Month.
I wish you the same. So we'll go straight to this conversation, the World AIDS Day. Let's just assume that nobody has ever heard of the word before, AIDS, or because of a certain slowdown in this, as it is right now, we seem to have forgotten what it's really all about. We'd like you to help us understand what exactly do we mean when we talk about AIDS? AIDS with an S to it.
Yeah. When we talk about AIDS, it means acquired immune deficiency syndrome. Syndrome because it cuts across different systems. Can be on the respiratory system, can be the digestive system, can be on the skin, but it is something that is a virus that is, it is syndrome that is acquired, and it makes the immune deficiency. That's why it is acquired immunodeficiency syndrome. It's an offshoot of HIV. It starts as HIV. HIV, as we all know, is the human immunodeficiency virus. HIV. So that's the virus. And then it graduates into becoming AIDS, because when the virus eats up the immunity, when it overcomes the immune system of that person, then the immune system becomes deficient, and every sign of low immunity starts to show in different systems.
That's simply the absence of immunity in a human's body. That's what it is. Then it exposes you to everything that can come.
Every little thing
in terms of disease. Okay, so now that we understand what AIDS, HIV is, so we'd like to go straight to, let's understand the origin, how it all started.
Okay, I think it started somewhere in Africa here in the 1970s, late 1970s, where they were able to see some men who had problems with their immune system. They were having illnesses like they were children. The illnesses that happened to children were happening to adults: skin rash, diarrhea, and then they were able to culture this virus out of it. And then the virus originally came from monkeys, came from human being eating poorly cooked monkey meat. That's where it came from. Poorly cooked monkey flesh. Then from there, it moved into the system of the human. Then little by little, homosexualism was what really propagated it in the early 80s. Homosexuality propagated it. Then in the early 80s, it was pretty much for only homosexualists. I mean, they asked, when you have any viral looking illness, the doctor will probably just ask you, are you homosexual? And if you say no, they just rule out HIV. But over the years, it has evolved, to becoming something for everybody, both male and female over the years. And then now it's even more alarming. It's even more alarming to know that more than 37 million people worldwide live with HIV. That's where we are now.
Okay, that's where we are. But because you're helping us get the origin of this, and we remember back as you move from the 80s, coming down to the 90s, there was this sense of once it comes on an individual, it's more of a death sentence. Why have we, it seemed like the urgency and that sense of fear is gradually moving away now. What has resulted in this?
Okay, so first thing is because so when they discovered HIV and AIDS back then, a lot of money went into research because they didn't want it to spread, unfortunately. But then the peculiarity about this virus is that it mutates once it enters a new host, meaning once one person gets the virus, it mutates into that person's genome and not the other person that gave the person. So it's different with everybody, but the same virus. So research went into it and they found that there could not be a cure. There could not be a cure, but there are medications that can really suppress the that can improve the immunity rather of the human being and suppress the viral load, hereby making the person more compatible with life, making the person live longer, making the person have a better immunity, And then I think that has probably improved a lot the life expectancy of HIV patients. It has improved it a whole lot massively. And then it has also made the human being a bit more lackadaisical when it comes to safe practices. Because apart from sexual intercourse, you can get HIV through sharing of sharp objects. You can get HIV through transfusion of poorly screened blood. Share and sharp objects will include barbers cutting clip and manicure and pedicure, drug users who use needles or who share needles. I mean, so people have really come out of that fear into believing that because there are medications now, they can actually live longer if they have HIV. But then we are actually not out of the blues. We are actually not out of the blues because I keep telling people, if you think that HIV is the only illness you can get through unsafe practice, then you are a joker. You are a joker. If you think you are being like a Nesca because you cannot catch HIV, then you are a joker. That's what I keep telling people.
Okay, so I just want to get back. I'll get back to you shortly, Dr. Abiona. If you're listening, we would like to hear from you this morning. You know, this conversation is also part of you. We'd like you to get involved in it. It's Lagos Talks 981, and it's a special dedication to today being set aside as advocacy and to create awareness about AIDS and HIV. It's the World AIDS Day and what we can do to stay safe and, of course, eventually defeat this disease. It's what it's all about. We can also get to hear from you if you send us a WhatsApp message on 0809-444-0981 will be where we like to read your WhatsApp messages. Let's even know what you think. Do you believe it still exists? What's your opinion about it? If you get to call us, you know someone, and what you can do to keep yourself safe. So we'd like to hear about that from you after now. So I get back to you, Dr. Abiona. First, when diseases, start emerging, there's this thing that it will be tagged a pandemic. Not too long ago, we're trying to get out of it as the world collectively from what you call the coronavirus now and moving on. But of course, this same term was used for HIV back in the days. So it is lackadaisical attitude you mentioned earlier on why people could let their guards down compared to how they were, up and they were very conscious back in the days. Could it be that it has been stepped down not to be a pandemic any longer?
Well, because there are medications now to help suppress the virus and improve the immunity of the patient, it might not be a pandemic anymore because the people are not actually falling.
We need to get your connection stabilized now, if we can get you back. All right, if you just
target a pandemic through and through.
You might need to go back. We lost a track of what you were saying a while ago.
Okay, can you hear me now?
Better, yes, please.
Yeah, I said because people are no longer dying from the illness. People are no longer falling sick from the illness as much as it used to be. Then it's no longer a pandemic. But then it is still a source of concern because just last year there was a record of almost 700,000 people dying from HIV and AIDS-related illnesses. So it's still not something to gloss over at all, even though there are drugs you can use for it now.
So two things would flow out of your submissions now. I like to quickly get, because you talked about the mode of transmission, how persons can get infected. Now, there was always that stigma back in the days where when someone is said to have HIV, the next thing is seen that it must have been promiscuous. Why would our mind always, once it happens, the next thing is he must have been so promiscuous or she must have been. That's why it will be. But you know, in your opening submissions, you had mentioned, you talked about raised sharp object and other things. So I'd like you to speak to that.
So, in mode of transmission of HIV, sexual intercourse covers over 80%, actually. But I have seen.
We'll make sure we just get to, you know, these are very important things you're trying
to. We have screened their spouses. Their spouse came out, the lady's spouse came out negative. So, but then over the years, she was living with her friend. She now found out that she was sharing a cortical cutter with her friend's mom. And then she found the drugs she was using in her friend's mom's bag. So it means the friend's mom was living with HIV and they were sharing the cortical, but she never came out to admit to her child and her child's friend. That's how she got infected. You get, and I've seen other crazy scenarios. I've seen people who practically patronize prostitutes. That's what they have. That's how they satisfy their own whatever. And then they have come down with these same illnesses, this same virus, and have infected other ladies in town. You know, and these are practical experiences. These are things we have seen over and over again. So I mean, so as we have it on the non-sexual part, it is so much more on the sexual part. Hence, the reason why people might try to tag promiscuity with it.
Okay. Now, of course, you made the global rates. You raised that 37 million people. They're said to be living with it globally. Let's bring it back home. It seemed like we are not out of the woods, and how much we are doing to create awareness and keep Nigerians safe. I'd like you to speak to the 2009 national policy on HIV and AIDS, and also NACA. What exactly are the rules to help us bring this down, the stem the tide?
Well, if you agree with me, back when we were growing up, we used to have a lot of condom adverts on radio. But where are they now? Where are they now? Back in the days, we used to have NGOs share free condom at events. I remember back then, my teaching hospital then, when I was a student, there used to be a row, a bucket made for condoms. So because all this awareness have gone, and then there has been the promotion of the fact that you can use post-exposure prophylaxis if you get exposed. You can use and ARVs if you get infected. You know, it has watered down the effect or the fear. But then we have over almost 2 million Nigerians living with HIV. Almost 2 million Nigerians. It is worse in the southwest and south area.
You will reel out
Lagos.
Dr. Abiona, you would reel out all of these facts in a bit now, so we just quickly would do that. So once again, we'll just let the listener know we will get back. We're just laying the foundation to have this conversation going once more. We'd like to hear what your thoughts are on 014489981. You think the government is doing enough? And what can we as individuals do to keep ourselves protected? And of course, our loved ones is what it's all about this morning as we look at the World AIDS Day. And the theme for this year is Let Communities Lead, is what it is all about. But that will be after this time.
Smooth 98.1. Love music, love life.
We're smooth. 98.1 FM is gone 18 minutes past the hour of 9 o'clock already. It's the 1st of December 2023. That's 24 days away from Christmas. Yes, throw that in. As we get the discussion going. You can't run away from that. But let's get on to the conversation, Dr. Adekunle Abiona, this morning. You were now bringing it back home now to help us understand beyond the global stats of 37 million persons living with the virus, that's HIV. What exactly you're bringing it back home to even the Southwest. So let's begin to see the figures converge around the regions of the country to make sense of it.
Okay, so as I was saying, as at last year, I don't want to mention the name of the states, but there was a particular state in the South which had the highest prevalence of HIV. This year, it has moved to a particular state in the Middle Belt that has the highest number of HIV cases in Nigeria. But the state that has the highest number of new cases is Lagos State, having almost 120,000 new cases in the last year. So it goes to show a lot. And then the role of NACA in this, NACA is the National Agency for the Control of AIDS. I mean, they need to coordinate and kind of sustain the awareness that is on ground by all sectors for HIV and AIDS, because I believe they need to increase the level of awareness that is out there to make people know that apart from HIV and AIDS, there are other crazy things that can even still kill you through unprotected sexual intercourse, and then because
Dr. Abiona, we seem to have lost connection with you a bit there, but just if you come back, you could just redo a recap for us. Let's get you to be part of the conversation on 014489981. Dr. Abiona is all yours as we look at the theme for this year's World AIDS Day. Let communities lead is what it's all about. Is the connection stable now?
Just give me a second.
Okay, I'll let you do that, okay? So let's get you to be part of the conversation while he resets the network from his end on 01448. That will be a call coming in for us. Hello, good morning. Hello. All right, do well to give us a call back on 014489981. Big questions you'd like to ask our doctor this morning. And of course, what other unsafe habits you think we should also try to get away from to keep ourselves safe and the world and our loved ones? Good morning. Good morning. I'd like to know your name and location this morning. Emeka, welcome. All right. So
have stopped out, probably because of other illnesses that are more serious taking on. But the reality is that it exists and it still kills a lot. As a matter of fact, so many people are walking around with it.
Yeah, I'm back now. Pardon me.
Okay. Yes, we've got a call, Dr. Abiona. So just listen. We've got an Emeka talking.
So one of the Dr. Well done. Thank you very much. Now, one of the most serious ways which has been highlighted is the sexual promiscuity. I advise people to just be careful. Even if you want to have sex, if you must have sex, especially illegal sex, protect yourself now. You see situations whereby some women will come and say, he impregnated me, he did that. It makes you have an unprotected sex. Once the person is HIV positive, right? And now you go to family. Yeah, you go to family salon, you see so many men, very, very matured men, well to do, come to salon to cut their hair without their own private clipper. Even some, the other day I saw one cutting his children's hair with public clipper. I called him out and said, look, my friend, you have grown past this. You should get clipper for these children, your family clipper. If in fact, as a father, if you know that you are promiscuous, don't even use the same clipper with your child. Because you might be HIV positive without knowing, and you now go and use it to cut your children. If anything happens, you may not forgive yourself. Right. So we need to be more careful. We need to be proactive. Communities need to wake up and do their best. Sensitize people, like the dog in the house was saying. Those are the days where they used to sensitize people, share condoms. These days, if you even share condoms, they say you are promoting immorality. You even go to chemist or to pharmacy to buy condoms. You see, most of people are shy from saying, "Give me condoms." You understand? It doesn't make sense. So let us be very, very careful. Let us be.
Okay. Thank you so much, Emeka, for your time and for speaking to the matter this morning. And once again, just to put it out there, it is the World AIDS Day, 1st of December every year. That's why it's celebrated. So when you hear these conversations, issues of the condom and sex and all of those mentioned, there's no way we can talk about this in codes. And it is because it is the way we have to get this message across. So, Dr. Abiona, you just listened to Emeka there, and he also has been. So, what would be your reaction?
I mean, he made very, very important and valid points, because the culture nowadays has pretty much been tagged as you are not woke if you try to stay safe. They believe you can throw caution into the wind. Many of the newly infected cases actually are men and women between the ages of 20 and 25. They make up 80% of the new infected cases. So it shows the age group that is really the target, that should be the target of prevention of HIV and AIDS. It should be everybody, but the target age group are the adventurous group and the group of youths who want to live life to the fullest. And then, getting infected with HIV goes hand in hand with the use of illicit drugs and recreational drugs too. So clamping down on the use of drugs can also help us clamp down on people losing their senses, and then it can make it a better Nigeria overall.
Dr. Abiona, so let's move on to, you've been able to identify unprotected sex as one of it, and Emeka also corroborated the point you made, sharing of sharp objects and needles. They talked about it. And if you move around the city, and of course we see those persons who walk about with scissors, this is not probably stereotyping anybody, but this is just because we're calling it out the way we see it. What they do is they are the ones who go clean people's nails, and you see that there's no means of sterilizing this beyond just some foam in one plastic bottle and just shake, and then they clean up, and then they're using it to clean your nails, and you feel like you belong already and you're exposing yourself. So take us to, I'd like you to speak to, now let's move on to cultural practices like circumcision, where people would use the same sharp objects for circumcision, and what the risk factors exposing us to?
I mean, so part of the cultural ways we transmit HIV also is circumcision, actually, and also tribal marks, where they give tribal marks. When you use one blade for many people at once, and also people who circumcise in late teens, when some of these children are already exposed to sexual intercourse without you knowing, so they now use that same blade to circumcise multiple teenagers. That is one very common way of spreading HIV. Also circumcision, also childbirth at the house of a traditional birth attendant. Some of these attendants don't even have anything sterile. We made a point now about the boys that go around with their own scissors and the manicure set. I mean, I've seen some who have tried to move a notch up in their sterilization, but it's still not enough. Let's not even joke about it. It's still not enough. If you are doing any form of manicure or pedicure, if you are doing any procedure that will involve blood or touching or scraping of the skin surface, it should be done with a set of new sharp objects. It should be done with a set of new sharp objects. That's not, it's a no-brainer. It's a no-brainer on that.
All right, so we'll get calls in as while you were trying to make the point. I understand some calls were coming in a bit. So let's see on 014489981. You can be part of the conversation now. Let's get your calls coming in as we speak on to the issue of World AIDS Day today. Creating awareness, advocacy. It just seemed like we can never be too safe enough, and we just can't relax. And see the age brackets you're mentioning. This should be the core, the productive core of any society, 18 to 25. It's quite scary.
Yeah, very true. I mean, so we need to catch them young. Increase moral.
Just hold on. A call has come in for you. Good morning. Good morning to you. We'd like to know your name and your location. Adekunle, you're welcome.
Agents of this thing. It surprised me because the world thought is gone forever. But now it's resurgence, it's really surprising. And to think of it, you see our
Adekunle, do well to please call back after now. So, but you were saying Adekunle is surprised at the moment, like at the stats you were reeling out, and you even saying, look, it's not gone. Wake up, world.
It's alarming. I mean, so by the end of today, new statistics will come out for 2023, and then it's as I was saying, we need to catch them young. We need to increase the intensity of the moral base that we pass on to the new generation. We need to sustain and increase the awareness.
Okay. Dr. Abiona will be back shortly. Just a moment. We'll just get this done and sort out the network, and then we get back, get some more calls in. Just keep the calls coming on 014489981. We're Smooth 98.1 FM. The 1st of December annually celebrated as World AIDS Day, and AIDS Day to create awareness and advocacy.
The meeting, please.
Plenty of vegetables like a fork and seasoned with the rich taste of North seasoning cubes. Even better. So go ahead and elevate your meals with more vegetables and the rich taste of Knorr cubes. Today, eat for good.
This is IBK Spaceship Boy, and this is your breakfast show on Smooth 98.1.
We're Smooth 98.1 FM. We're back. It's still Lagos Talks 981, and this is a special one in commemoration of the World AIDS Day being celebrated every 1st of December. This year's theme is Let Communities Lead in this fight against AIDS and HIV. A caller waiting already. Hello, good morning. Good morning. Name, location. Let's get you talking. Chika, you're welcome. So, are you surprised we're back talking about the resurgence of AIDS and what it can do to our society?
Worry this morning these days. This thing has been with us close to 4 decades now. From its introduction, that it actually started in 70s, late 70s into 80s. But my worry is this: why is it that after almost 40 years, we've not actually been able to find a lasting cure to this pandemic, if I may call it that? And I say this because we've actually witnessed some other ailments or disease that are actually more severe than this. Most recent one is COVID-19. We saw the haste at which scientists, people came actually provide a solution, come up with a vaccine for it. And today, you and I would both agree that COVID, as it is more or less like a thing of the past. Also, scientists have also been able to find a lasting solution to cases such as hepatitis B, such as malaria, such as even typhoid, and some of these ailments out there. But why is it that after 40 years, we've not actually been able to find like a kind of a vaccine or something that would prevent the further spread of this HIV and AIDS? And let me bring it home, because from my own deduction, I want to liken it as it's more prevalent in Africa. Maybe because that's the reason why the Western world are not actually paying more attention to this. What is stopping African scientists, pharmacists, and medical personnel from going about carrying out research to make sure that we tame this menace called HIV and AIDS? Because truth of the matter is that it's ravaging more in Africa than it's ravaging more in other parts of the world. That is my question to Dr. Abiona this morning. Good morning.
All right. Thank you very much. Thank you so much, Chika, for the call this morning. It's all yours now. When you finish with him, there's a follow-up to this question, Dr. Abiona.
Sorry. So I didn't quite get his question. My network was
okay. This is the issue. After close to, let's say, over 4 decades now,
we still don't have a cure.
We still don't have a cure, but yes, we just in 2020, let's say by late 2019, 2020, before we COVID-19 we're done already. So why isn't the world taking it with this urgency it deserves? And finally, he wraps it up saying, could this be because it ravages Africa more? That's why they are not bothered.
Well, the truth is there is research going on year in, year out to try to get a cure for HIV. But because of the peculiarity of the virus, as I mentioned, that when it enters a new host, it changes form, in quotes, to be part of that person. So it makes it difficult to get a cure. But I believe that there will be a cure as soon as possible, as soon enough, because in the last 2-3 years, there has been some near misses in terms of research where people have come out with a drug and at the end of the day found out that it didn't work as much as they thought it would. So I believe we are getting to it, gradually. And it's not like COVID-19, because COVID-19 only affects the respiratory system, which makes it easier to track down.
Just use that as an example, just to see the urgency and how they can.
Yeah. But then there's research going on year in, year out as to trying to get a cure for HIV. Yeah.
Okay, I have a question. There is this myth I'd like you to help us address. It's said in some quarters for persons who, when you begin to speak with them on the reality of HIV and AIDS being with us and how they need to be careful. First, you're told it's spiritual. This is spiritual, and then they come up with a lot of stories of conspiracies of it is brought out to wipe out the certain race and all of those. You are here. Speak to us about this myth, and you can just debunk them.
I mean, in my years of practice, I've met patients who have contracted HIV and they didn't believe they had HIV. One of them is dead right now. He did not believe he had HIV. No matter how much tests we did, he just believed you are cooking up numbers. You are cooking up results for me. I don't have it. I'm strong until he started falling sick. HIV is real. Let's not joke about it. It's real. It's not a conspiracy. It's here within our midst. It's killing us. And the earlier we open our hearts and ears and eyes towards accepting it and taking strict measures to living safe life and having safe practices, the better it is for us. You can have all the enjoyment you want to have, but have it safely. You must have it safely. Stay safe. That's it.
Okay, so now from the doctor, it says this is not a myth, it is real. So we need to also take responsibility of our actions and how we live to protect ourselves and our loved ones. So once again, this is about the people too, so they need to get to call in. So let's get some more calls in. If they've got questions for you or they want to share experience, we'll get it in. 014489981. A call is waiting already. Hello, good morning. Good morning to you. Please, we'd like to know your name and location. Dr. Abiona is here for you. Lucky from Ejigbo. So let's get to hear your point this morning.
I think the government will look into very much is the control of the illicit drugs. Because for that figure Dr. gave of 120,000 new people with HIV, it's an alarming figure. And if you check the age range, it is 20 to 25. That means there's an age range that is prone to the use of illicit drugs. And there's something about illicit drugs or alcohol or whatever, is that when we are under the influence, whatever fear, whatever knowledge, whatever information you have about HIV/AIDS, it plays off temporarily during that influence of illicit drugs. I think there should be various ways of controlling the use of illicit drugs if we actually want to also control the spread of. Thank you.
Thank you very much. I just had that's Lucky who called in now. So Lucky, thanks very much and keep listening. Let's get one more call in and then we'll get back to the doctor. Hello, good morning. Hello, you're on now. Good morning. Okay, well, when you're ready, just give us a call back. Good morning. Good morning to you. We'd like to know your name and location. Fabian, you're welcome now from the mainland. So let's get to hear you and your reactions to what Old Doc has been saying a while ago.
Well, I heard what the doctor was saying. I was just a bit concerned about his statement. Maybe he didn't make it intentionally when he said, if you want to have fun, just have fun and then use a condom. One of my concern was that even when we used to try to, and we still do, we speak about AIDS prevention. The first thing we try to put is the issue of avoid abstinence. But if you can't, rather than saying just go and have it, why just go and have it? Because as of yesterday, I had a patient, I'm still talking with that patient who got pregnant because of an issue. And then another one was an STI who, because he was using condom and it burst. There are the issues even with condoms bursting and people contacting HIV. There have also been issues where somebody uses the condom, still wants to have fun, the condom has finished, and now goes ahead to continue. So even when we are speaking, also the adolescent and youth, everyone knows that when one which delays as much as possible and is more responsible, there's a lower risk of contacting HIV because person will not be following having sex round the clock. Even in universities where they are giving out these things during programs, a lot of times people did do it without it. So you need to speak about that. Second one was just in relation to, apart from prevention, was people going to go and get tested. Because when you go to go and get tested, which is free of charge, you can get informed, you can be knowledgeable, and then one-on-one. Sometimes people don't come out to ask questions when they're in a group. But when they're one-on-one with a HIV counselor who is trained, you can able to educate this person on things to do, what to avoid, and then if the person tests positive, help the person to now either disclose it or get the partner or whoever was also going to get tested. One problem that we have is that some people, when they find out they have it, they go on a spree to spread it to other people. So HIV is important, it is preventable, but at the same time, if one has it, it also one can live a long life if one goes immediately to the hospital and follow whatever is told. I don't know if you mentioned that.
Oh,
thank you.
Thank you very much, Fabian, who just called in a while ago. So these are issues on the table right now. Let's get back to Dr. Abiona. The issue again, it raised it. I'd like you to get your response.
Okay, for the first caller, who spoke about clamping down on illicit drugs, which will
you were far away from your phone. Your audio is not as strong as it was earlier on, so I don't know if you're far from your phone. You need to come closer.
Okay, how is it now?
Okay, let's hear it. Go ahead.
Okay, so the first caller who spoke about clamping down on illicit drugs being a way to also clamp down on HIV and AIDS spread, that is very correct. That is very accurate, because nowadays the type of things we see out there now is really alarming. That's the truth. It's really alarming. Then the second caller raised a very, very valid point. Abstinence and raising responsible role models is like the baseline. It's the first thing to do. You know, abstinence is what we always try to preach. But I'm just trying to be very, very factual. I'm trying to be very, very sincere and truthful, in tune with what we have, what the reality is. You know, of course, you know, and also he raised the point about getting tested periodically. Yeah, I was going to get to that, because if you don't know your status, you might not know how safe you need to be or how to live your life. You can be positive, but also live positively. There's something called positive living positively. As people who know they have this virus, they are on medication and they are living life to educate people and try also not to spread the disease. You know, so that's positive living positively. And then if you get tested and you find out that you do not have the virus, then it's also safe enough for you to now take responsibility and stay negative.
Now, in this testing, how often, since it's testing, so once in a lifetime testing, one walks away and then you can raise your hand, you can feel free to fly, and then until when? How often should this testing be, should it go?
So we advocate that every 6 months you should get tested. If you are that active, get tested every 6 months. But then there are some people who are high risk.
You mean sexually active people? Because this is, we need to...
Yeah, so people who are sexually active, very sexually active, and also people who are health workers who are high-risk people, you know, they should be wary of getting tested more often. Yeah.
Okay, that makes a point there. So let's go on now to the issue of, I listened, Fabian was talking about how people would go for testing, and then somehow there's this issue of how to overcome the stigma associated with, you know, finding out if one is positive and how to have a positive life thereafter. There are also concerns about, you said, living positively with the disease, but then again, what's the possibility of living a fulfilled, full life, even having a family? That will be after now, Dr. Abiona. So stay tuned. We're Smooth 98.1 FM. Stay tuned.
This is Jessica Bongos, and you're listening to the Smooth Breakfast Show.
Takes a plate of jollof rice to the next level of goodness. This is when it is cooked with non-seasoning cubes for that sumptuous taste. Or when you serve it with correct Nigerian salad, cabbage, carrots, lettuce, and a bit of kidney beans.
It's both. Season your jollof with the rich taste of Knorr cubes and serve with plenty of vegetables. So go ahead and elevate your meals. Today, eat for good.
Come lunchtime on Smooth 98.1, we serve you world music. Travel Africa and the rest of the world as we bring you the smoothest collections of traditional rhythm, It's a rich blend of strings, percussions, wind instruments, and voices. Indulge yourself and go beyond the music.
The greatest activity in music happened during the apartheid era, and great musicians came up out of that era.
The unique sounds of places, people, and culture that come alive in your soul. It's a taste of the world on the Casbah, here on Smooth 98.1, weekday afternoon from 1.
We're Smooth 98.1 FM, 13 minutes before it is 10 o'clock, and it means we're gradually heading to the close of this conversation. Lagos Talks 981 is still about the World AIDS Day, and it's all about advocacy, awareness, and everything to keep the human race safe. 37 million people living with the virus, according to the figures from the professionals. That's what we hear this morning. And it's not far away from home. It's right now, it's with trepidation right now. If you walk out and listening to what the doctor is just even trying not to even make you so scared when he tells you even it's closer home. Look at the rate, the fresh cases he talked about, over 100,000. And many more issues we can begin to talk about. Dr. Abiona, one more call in for us. Hello, good morning. Good morning. Dr. Moses, you're welcome. Let's get to hear you. Dr. Abiona is listening.
When it comes to it, I've read tons and tons of documents, journals, books, and I remain skeptical forever. The idea of HIV working running into AIDS is not convincing to me. I'm not an expert in that field, but I don't have to be a doctor. I have the super mind, excellent mind. I'm too cerebral to be put down. Like AIDS, like COVID, anything that comes from America or from the West, how on earth will a disease, a so-called deadly disease that originated from the temperate world, where there is nowhere, everything like that, suddenly in less than 30 or 40 years has become a black man's disease. Malaria was covered 100 years ago or thereabouts. It still remains a black man's disease. How will have my doubts? So for me, I found right because I'm never a supporter of morality. My self will never accept it. Not this protection, I'm not an advocate of it. But I remain ever skeptical. I've read several from all angles of the world. Not just that even that from the distant region of the world. The West will propagate all manner of things. And it becomes the world disease. How? How will HIV be born into AIDS? They can call it whatever it is. What they do. But for me, as I said, I'm not for morality of any faith. But how that disease became the black man disease.
All right. All right. Thank you so much, Dr. Moses. Yes. So you remember when we asked you to debunk some of these myths, and now you can see. So it's good we have all shades of these opinions now converging as we're getting ready to sum up this conversation this morning. But you listen to Dr. Moses now. Talk to me about, and if he's listening right now, it needs to be convinced.
Well, medicine is evidence-based, and we won't propagate or we won't discuss things that we do not have evidence about. You know, I understand his point of view, his ideology about it, but it still does not change the fact that HIV is real. HIV is right here within us and is killing us. He might be lucky enough not to have anybody in his circle who has been infected or who has died from AIDS. But the truth remains that medicine is evidence-based. We have evidences flying everywhere. This illness, this syndrome, they have symptoms that come together. And we have test kits that shows us if it's positive or if it's negative. We have other tests that checks viral load. We have other tests that checks CD4 counts. these are the evidences we put together that makes us know that this is ravaging. This is still in our midst and is still a problem to deal with.
Okay, doctor, now I'd like you to speak to us to affordability healthcare when it eventually one is found to be positive and how affordable it is, so people begin to understand what it entails.
Okay, so currently in most government hospitals or primary health centers, remember we spoke about primary health centers last time.
Yes,
HIV testing is free. HIV testing is free. And when you get tested, there's a counseling session where if that person is positive, or even before you get the test done, normally a counselor should speak with you. And then if the test comes out positive, you still speak to the counselor. And then the mode of taking care of HIV positive patients now is that they start taking drugs immediately. The drugs are free. World Bank sponsors some other global agencies sponsors, and federal government sponsors 5%. So this treatment is still totally free. The drugs are to be taken for a lifetime, but the drugs are totally free.
So what does it do? What does it say about the ability to have a healthy reproductive life after one being found, or maybe even being able to get offsprings? We'll speak to that a bit as we close up now.
Okay, so it's interesting to know that a mother, a woman who is HIV positive, or a man who is HIV positive, if he uses the drugs properly, his viral load becomes so low, he won't be able to infect somebody else. At that point, he or she can get married, the woman can get pregnant, and the man can impregnate a woman without infecting her. And when she's pregnant, she's expected to continue using her drugs so as not to allow the virus get to the child. So when the child is born, the child is usually delivered through cesarean section so as to prevent complications that can arise and cause transmission of HIV from mother to the child. And then there are still some measures put in place when the child is born, so that the child does not still get infected. We also ask the mothers not to breastfeed most times so that they don't infect the child.
Okay, well, doctor, it looks like a very, very hopeful note, optimistic note to end this conversation in a very bleak situation, but then it looks like it. So I want to say thank you so much for taking your time.
30 seconds. 30 seconds.
Please do. Go ahead. You have it.
The theme of this year's World AIDS Day is let community lead. Meaning is the aim is to allow communities erase stigma from people who have been infected and people who are living with HIV. Let's take it from the community level to know these people one-on-one and encourage them to live a good life. And also live positively, impacting other people in the community.
Thank you so much, Dr. Abiona, for your time. Would reach out to you anytime when we need clarifications on health issues. Right. Thank you so much. Do have yourself a great day. Bye.
And you too. Thank you. Bye-bye.
And there we have it. The conversation comes to an end. It's still all about the World AIDS Day with a theme, let communities lead. We need positive actions to, stem this disease. And the doctor said it's not a death sentence any longer because of some breakthroughs already, advancement, and it's still not there yet, but at least it's not as bad as it used to be. So it says, get tested. Every 6 months you go get tested. And of course, he's advocating for every 6 months, no sharing of sharp objects. Don't share razor blades, scissors, and all that. Get your own clipper, and every other thing has been said. And then it says safe sex is important. You can practice fidelity if you're married. Stick to your partner. And then if you feel abstinence is you can't hold yourself, they're saying there's a way, use a condom. But again, you're told it's not 100% even if you're using a condom. These are the words of the professionals who've been speaking to us. And so I want to say thank you to Emeka from Lagos, who opened the conversation for us this morning. Always great to hear from him. Adiola called in. Chika also was here a while ago. And then I had Lucky from Ejigbo. Dr. Fabian also from mainland also had a great cause to, chip in valuable insights into the conversation. We appreciate you. But then this conversation, usually when you have a crowd of people speaking on issues, you must have divergence in it. So if everyone has come to say they believe in what it is, it would be like, well, it seems everybody had a meeting to be here. But one person who called in, Dr. Moses, is a Dr. Moses, PhD. It says he does not believe that this is strictly an African. There must be something more to this. All of this, there must be opinion, but then stay safe. That's what we call for at this time. My name is Omatseye Atsenuwa, asking you to stay tuned as I step aside as Oluwaseun comes in for Strictly Soul. Good morning.